Great. Wonderful. So welcome to the Council of Governors meeting in public on Thursday, the 5th of February. This is for Northamptonshire Healthcare Foundation Trust. And it's great to have you all here. We've got a wonderful turnout. Great to see everybody. The only apology that I've got listed is Lisa Pearson, Staff Governor. I'm not aware of any other apologies. Tracy.
We've got 2 more apologies from Heather and Summer as well.
What was the second one? Sorry, Tracy,
It
lost
was
that.
Summer and Heather.
Okay, lovely, thank you. So we'll record that for purposes of the minutes. The item 2 on the agenda, which is the declaration of interest, which is paper B, which was circulated in your pack. And the government declaration's interest log is always circulated ahead of the meeting. You always have an opportunity to make sure, if you haven't done recently, please log on and make sure you've updated the register. But in relation to any items on the agenda for today, are there any other declarations that anybody feels in relation to the items they want to notify us on?
One of our internal ones, or is it one for insurance, external insurance?
I'm not sure that was a declaration, or whether someone just left their mic on for a moment. Was that a declaration? No, I don't think it was. No. Okay, great. And then if we move on to papers C in your papers, which is the minutes of the previous meeting from the 4th of December. First of all, in terms of accuracy, those of you who were at that meeting, are you happy with the minutes in terms of its accuracy? Yeah, I'm getting nods. Thank you very much. And on that basis, we can then approve those minutes as an approved accurate account. And then we've got any matters arising from anybody? I don't think there is anything that anybody wants to pick up. I've not been notified of anything that you wanted to raise. No? Okay, thank you very much. In terms of the agenda, one of the things we've done, I didn't feel it was necessary to send the agenda around again, but we had an approach from Angela as our chief exec because she has to disappear for another meeting. So I've agreed to, with support of the corporate governance team, to move Angela's update from the chief executive to the first item. So Angela, if we go to you for your chief executive report, and again, I always assume the paper's been read, but Angela, please feel free to draw out any key highlights and things you want to share with the Council of Governors and members.
Yes, thanks, Faisal. And as you said, the papers have been circulated, and including Dave Mayer as Managing Director has also done one as well. So hopefully people have received both of those reports. Good to see everybody. That's the first thing to say. And apologies that I've got to leave early on this occasion. But always before, the Council of Governors asked me just to think about, well, as well as the paper, what things are really occupying the mind and the focus, really. So always take that opportunity to do that. And I think above all else, we've had a lot of focus, as you can imagine, and people talked about the weather, but winter is very much apparent, and we are working very hard with partners in our services, whether that's mental health, children or community. And I know Anne is probably with us today, but that has been significant and is ever a daily exercise. So I think important just to stress to everybody that it remains a very busy period generally, but winter does bring with it additional pressures and additional expectations on us, and that ebb and flow and flex is required on a daily basis. You'll see in the report that we're also in the process of the Advanced Foundation Trust pipeline. Davy Williams, as Group Director, is leading this, supported by key colleagues Richard Smith and Dion Mayhew as well. And I think they're doing a sterling job of giving us a really strong submission into NHS England. It's a series of things, it's data collection, it's evidence, but it's also a lot of observations. So we've had observations at committees and board. So a really sort of sense of triangulating and understanding the perspective from NHS England. And at the same time, we're also preparing for submission around the integrated healthcare organisation element, which is a contractual mechanism that we may be able to have as a trust if we get through the gateway of the Advanced Foundation Trust. But again, this is all very new at a national level, and we are going through that currently. So that's clearly a lot of work for people across the organisation, not just the executive, but important just to flag, I think, to governors. Again, a really key part of this quarter is the planning period, and Dave Mayer leads that with colleagues, but that does, again, need triangulation of information, whether that's workforce, activity and performance, and finances. So a lot of analysis and understanding in terms of the contract offer we receive, and also then what we are expecting to be able to do and deliver into the coming years. And of course, with that comes an expectation of cost efficiency and value. We have a very strong value programme, but as ever, the increasing level of percentage and cost efficiency is one that challenges all of us. And I think it's fair to say that really does occupy the mind at the moment. At the same time, I think some really good an important focus on managing change. Sarah, as our Chief People Officer, has introduced with colleagues, again, a lot of work and focus about how you lead through change. We know change is going to be the constant and the feature that involves all of us, whether you're managing teams or within teams. So we've done some extra work to try to support staff who are obviously going through those processes and make it relevant to all. So again, additional to what we supply already in terms of health and well-being, but also key processes as well. And then finally, just to mention, I think just to take the opportunity that we had our REACH celebration event on Friday evening. I'm the exec sponsor of that particular staff network, and that's our Race, Ethnicity and Cultural Heritage Network, a really important part of our staff voice and experiences. And the celebration event was great. It was organised by the network, so a really big thank you to them. But just to say that Anu, I hope she won't mind me saying, did get an award for outstanding contribution to the network, and I think there was a few tears amongst us, wasn't Anu, in that sense. And I think it was a great achievement and celebration, and we had a fantastic evening. So I just want to just share that with everybody as well. And I'll leave it there. Thanks, Faisal. But equally, if you wanted Dave to say anything in relation to managing directors in terms of trust, then I'm sure Dave would be happy to do so as well. Thank you.
Thanks, Angela. Thank you for that highlights from your report, and everybody will have had a good opportunity to read through your report. Before I bring Julia in, Dave, was there anything you wanted to highlight from
thanks, Faisal.
perspective?
Yeah, just I guess again from the report, just to flag for our constituents, important that we've got a new award-winning inpatient unit for young people's mental health care. The set has moved from its standalone site to Berrywood Hospital in Northampton. So that's a purpose-built, fabulous facility for our young people and for their families. So just to flag that, I think that's really important for our wider membership to know that continuous improvement in our estate continues. Equally, just to flag some of the work that's happening in diabetes, and again, the benefits of working in a system with a strong healthcare charity is that there is a significant legacy now being deployed across the county from charitable funds to support improvements in diabetes. We'll be linking in with particularly Kettering General in terms of that pathway, but equally that links to our diabetic eye screening team, plus our teams working with diabetes more generally, including a high risk foot. So just to flag that, I think again important for our populations to know about those improvements. And then just finally, just to update on service visits continue, and of course for governors who want to attend, do link in with Simone via the service visits inbox. We can hopefully facilitate supporting governors in that way. Thanks, Faisal.
Thanks, Dave. Thank you for your highlights there, which are appreciated. Let's go to any questions or points of information for either Angela or Dave. Let's start with you, Julia.
Thank you, Faisal. Sorry, Dave. I think I cut across you and put my hand up a bit quick, but sorry about that. Just to add something, Adam's put something in the chat around, in Angela's report, the Mental Health Act received royal assent in December. It's the Mental Health Bill. Just to say that as a board, we've had a joint development session with Leicester Partnership Trust. I think it was back in November time, around the changes. And just to say that a couple of weeks ago, we had a Quality and Safety Committee session around this as well, because we'll keep an oversight through the Mental Health Legislation Committee of any impact for us as an organisation. There will be impact, resource implications, as well as lots of improvements for patients and families. So that's really good. But just to let everybody know that we've got that on our radar. And just to add into Dave's last comment around service visits, just to remind governors that may not know that we do actually have a thematic look at the service visits that are undertaken each quarter, and that comes through Quality and Safety Committee, and then we bring through any learning in our reports up to the board. So just wanted to add those two extra bits in. Thanks.
Yeah, thanks, Julia. And just to underline the point Julia made about the training on the Mental Health Act and the changes being proposed and the royal assent given, the training that the group board received as part of their development workshop was from highly specialised legal team and Mental Health Act specialists. So it was very comprehensive, and the learning that we took away collectively as a board, that it was so much information that we would in future look to have a much longer session, because there was so much to kind of really digest, in the sense that we want to give it much more airtime going forward. And one of the things that we've agreed is at some future point, once the Act comes into being and actually is being enacted and implemented, that we will have a follow-up session as required. So just wanted a little bit of additional reassurance to colleagues in relation to that. Mark.
Yeah, a couple of questions. One for Angela, and one might actually be more for Anne if she's able to give an update. Angela, it's that wonderful time of year where we're all worried about kind of like what the end of year finance is looking like and planning for next year. So I just wonder what it was feeling like kind of contractually in some of those discussions, and is there any news yet on potential inflationary uplifts? And then the second question, which was probably for Anne, there was some really good early work going on around neighbourhoods, and there was a good workshop in December, but it seems to have gone a bit quiet on that front, and there's no like steering group or any meetings, I don't think, in the diary. So if Anne knows anything on that score, that would be good to know as well.
Yeah, no, thanks, Mark. And I think several things in that. So from this financial year, we have had, as you know, a break-even plan, and we have continued to forecast delivery of that, and that's our expectation. And within that has been a circa 6.2% CIP value, cost efficiency. And so you can imagine landing that is still not achieved, but we are still forecasting that position. In terms of contract, we anticipate to have similar levels of cost efficiency into 26-27. That's the assumption. Our board will be discussing more about that next week as well, because we're working through all of that and achieving planning submissions. I think it's fair to say, in terms of inflation and growth and all those elements that are part of that, that there is limited effect in terms of increases, because whilst, you know, effects get passed on, Mark, in simple terms, things like pay awards, all the rest of those other things are things that the trust has to absorb itself. So the net effect is no growth really, in essence, and that's difficult, as you can imagine, which is why it leads to those levels of cost efficiency. What we're doing at the moment is working through all of that to understand if that leads us to differentials in cost efficiency and value programme coming into the coming year. And that's something, you know, Dave and Paul and the colleagues are looking at to see if we need to understand that differently. And of course, we've also got different commissioners across our services who equally have different perspectives in terms of contract values, etc. So it's not just always the Integrated Care Board as well. We have local authorities and others that, and NHS England, that also give us contractual elements for the coming year. So, but in essence, I think the sense is not growth. There may be new investments in things, that's yet to be decided, but that's in effect about more activity as opposed to growth for current.
Thanks, Angela.
Thanks, Angela. Your other point, Mark, was about specific. Do you want, Anna? Are you able to comment on that? Oh, yeah, there you are.
There you are. I'm hiding on another screen, probably. Yes, very happy to comment on that. So we did have a really good workshop at the end of last year, which was helpful to bring partners together. It is progressing. So I met with Melanie Williams the end of last week. So she's leading executively to develop the neighbourhood group so that we've got a really good governance structure to work into. And those dates are going into the diary, Mark, so you should see them pinging in soon. I'm just keeping close to her on that and supporting in that work. There has been some changes to some of the ICB personnel, and we have seconded someone into that system space, a leader into that system space, to ensure that the work keeps going, the wheels keep turning and things keep happening. So that's been really useful because Tracy Dempster is working into that space at the moment and has really great experience of working at neighbourhood level. So that's been positive. And we also had another VCS FE sector meeting, thinking about how we at NHFT work with the voluntary sector to continue that neighbourhood discussion and where there is alignment and where there's things that we want to develop. So we came away with some really rich information from that as well to feed in. So we're keeping ourselves as close to the detail as we can, because clearly it's got to be a key part of our strategy, and it feels like we've got some real momentum as we come into this year to get that moving. So thank you, Mark.
Oh, great. Thanks, Anne. That was really useful.
Thanks, Anne, and thank you, Mark, for your question. Let's go to Dave.
Thanks, Faisal. Just to link on that, I should have mentioned it during the Managing Director's update. We hosted a successful event with the voluntary sector, the voluntary community social enterprise faith sector in the county, and NHFT convened it. And we had a good session on neighbourhoods across tables. There was about 80 people in attendance from across the different organisations in the county that are supporting different pathways, and we had good breakout sessions with people kind of attending our mental health and learning disability autism tables, CYP, community services, etc. So an ongoing conversation with that really important part of the infrastructure in the county, and links with the comments Anne's making about neighbourhoods and getting into that frame of mind with our partners more generally.
Right. Thank you, Dave. That's very helpful to hear, and to thank you for picking that up in terms of your update. David.
Thank you, Faisal. And just to come back round onto a couple of other bits. So Anne and the conversation is working across the whole of Northamptonshire, but picking up on one of the conversations from the Governor workshop earlier, just also wanted to reinforce, as well as the conversations across the county, there are also conversations happening inside West Northants and NHFT, and inside North Northants and NHFT. So particularly the directors of public health are really interested, and we're exploring different ways of making things work and what we can do differently. So it's connecting. I just wanted to be clear, it's connecting great across the county, but also those separate bits of conversations around place as well.
Right. Thanks, David. That's good to hear. Thank you for joining the dots for everyone. There was just before we move on, just one final thing in the chat was from Michael. He was asking the question about what have we as a leadership team done to support the impact of corridor care, particularly which is affecting acute organisation. I guess Angela linked to the winter pressure stuff. And do you want to come in on that?
Yes, yeah, I think it's something that we see a lot about in the press, and it's really quite disturbing. And if you walked around the acute hospitals last year, it was really very evident of corridor care. We are very fortunate in NHFT that we don't have any corridor care. We're not the sort of, we haven't got the environment or the flow for that to happen, but we are very much part of the system winter plan to ensure there's good flow through our acute hospitals. So we've had a change in focus, I suppose, the last winter, but really coming into this winter about having an all-year system urgent care plan. This wasn't just about what could pop up just before Christmas. This is about how do we work all year, recognising that really that surge period over the winter. And we've had some quite distinct winter plans put in to support, not only trying to support more people in the community so that people don't need to go into hospital, but also enable people to flow out of the acute hospitals, therefore supporting the flow within the acute hospital and working on them minimising and reducing corridor care to an absolute minimum. We have had a much better winter than we had last winter, but we're still in it. As Angela mentioned, it's busy every day. There's peaks and flows that we have to respond to, and it feels as if the system approach is much more agile than we've had. Not altogether sorted. There's still a lot of work to do. There's hotspots of areas of work, but our teams in NHFT really have got behind this, particularly our urgent community response through our intermediate care team, and our community beds have really worked at enhancing. They've all had increases in their work. There's more staff, there's more units or more beds, and this has been a really incremental but important part of the plan. So our staff have played a really big part in trying to reduce any corridor care in the acutes.
Thanks, Anne. And Michael, I hope that clarifies and responds to your question. And my sense on the kind of pressures on the acute is that certainly, as you say, we've been working to support system partners around this flow issue, etc. But also my sense was that from previous years' learnings, the lessons learned during the pressure periods, because one of the things that we have seen is that the winter pressure seems to be far more elongated period than ever before. It's not 1 or 2 months, it's like 4 or 5 months pressure. It's, it's unrelenting. And my understanding is that as a system, we've got much better at planning for those because we've had to. I mean, is that your take on this?
Yeah, absolutely. And as I say, it's planning all year, and we're talking every week about it. The Urgent Care Board in the system oversees 6 pillars of work that works from community right through to leaving hospital, and we definitely recognise the need for surge in the midst of winter, but actually it's about having good practice all the way through, and what can we learn and build on. And we have very good reviews, particularly last summer, of what did we learn last year, what new things we want to put into place. Our teams prepare for that by looking at NHFT and what we've learned and taking that into that system space. So it's a really iterative process that we're trying to get it's more about urgent care, not purely about winter, so that people are considering that length of time.
Excellent, thank you, Anne. That's very, very helpful. Adam, final point from you, and then we'll move on.
Yes, very quickly, Faisal. Thank you. Yeah, I've heard colleagues. I say colleagues. People. I'm not sure if that's the correct term. Talk about place and development, and presumably that's from the 10-year health plan for England. This idea of more neighbourhood focused services, and I just wasn't sure if health colleagues were aware that the DHSC is, I put it in the chat, published a policy paper just before Christmas setting out priority outcomes for local authorities from 2026 to 2028, a third of which, priority 3, and it's, if you'll see when you follow the link, it's that people drawing care and support experience joined up health and social care services at a neighbourhood level. It's all about co-developing health plans and all that kind of stuff, integrated health and social care. And I just wondered if an HFT were cited on that. Obviously, that's their responsibilities for local authorities, not for you. But I just wondered if you were aware of them. That was my question.
Yeah, very easy to answer. First, yes, we are, Adam, and you'd expect to hear that from us, wouldn't you? Absolutely. And let me bring you in for a bit more substance. Why? Yes.
Yes, and we're working very closely with social care. So. And that's why very intentionally as system execs we brought the consideration that was accepted that someone from the local authority leads the board for neighbourhoods, and that's been a really important step, and it's good that both places have agreed on that. So I meet with David Watts from North as well as Melanie Williams from West. And although Melanie's chairing, they're very keen on progressing that neighbourhood working alongside the guidance that they've got. So it's very much a multi-agency offer. It's not social care in one side and health in another, but very much joined together. And some of the discussions that myself and Melanie were having in preparation for the next board is, what does it look like all working together in a shared area, a shared geography, and reducing down the organisational barriers, because that's not what patients and populations need. So yes, very much integrated.
Thanks, Dan, and thank you everybody for questions to Andrew and Dave's report. So we received the reports for information seeking clarification and noted. Thank you very much, Angela and Dave. And we'll move on to item 6, which is our governor's story. And this is with Mabel Blades, who's our public governor. And Mabel, you're going to share your story for Wellingborough and East North Hants. Mabel, are you there? You were on my screen a few moments ago.
You're on mute, Mabel, if that explains it.
Can you hear me now?
We can.
We can.
My computer doesn't like me talking, I think. It keeps popping onto mute. Anyway, I'm Dr. Mabel Blades, and I'm public governor for, obviously, Rushden, East North Hants and Wellingborough. So I was asked to say about why I became a governor. So I was a governor at Kettering General Hospital. I did the full 9 years there. And originally, I'd never thought of becoming a governor when I became a governor there. And I was asked by Donna, who was then the equivalent of Tracy, to submit to become a governor. And I thought, well, I'll do that. And she put together something for me because I was very busy, and I was elected, and I was over the moon, never thinking I would become a governor. So I did my full 9 years there. And then obviously that was the end of that. And I realised there were opportunities in this trust. And I thought, no, I've done quite a lot. And then I was persuaded by those I'd represented that I should stand for election. So I did, and I was overjoyed to get in. So thank you to all those who voted for me. So what am I keen about? I'm a trained dietitian, and I'm passionate about people in care that they should be properly nourished. I think everybody should be properly nourished. And I often do expert reports, and it absolutely breaks my heart that some people die of malnutrition while in hospital and also in the community. It really is awful. And I've often appeared in court defending my paper on this. I just find it's absolutely awful. A friend of mine's husband was in hospital. He was not eating, given supplements, but on the ward they weren't giving him the supplements, and I just find that absolutely awful. So I'm really keen to see how a non-acute trust functioned, and I've been absolutely amazed. It's so well organised, absolutely very well controlled, and it's so different. At Kettering Hospital, I could walk onto any ward as long as it was planned, and I wore my badge and was dressed appropriately. So this is very different. I've only managed so far to do one visit as a governor, and that was to Berrywood. Now, as a dietitian, I've been very much involved with those with eating disorders, and I have been to many private facilities and helped with work there. And Berrywood was astoundingly good, really, really impressive. I found everybody was working together. And while I was there, I'd just been round one of the wards, and one of the workmen turned up to put something on the wall, and he was almost part of the team. He knew the patients, he knew the staff, and I found that so rewarding, because I'm conscious that some of the people with eating disorders that I was involved with in the past, it was sometimes a bit more lax. And I can think of some people, I can think of one lady with anorexia nervosa, and we thought, this is great, we've got her interested in knitting. And she knitted and knitted. And people often with eating disorders, particularly anorexia nervosa, often don't want to be there. And she knitted and knitted, and she knitted herself a dress. We didn't realise what she was knitting, or the staff on the ward didn't. And she made this dress and she absconded, which was absolutely awful. And to have to bring her back, and I just found at Berrywood, it was so good. Everybody was aware, and I felt that if somebody had tried to do that at Berrywood, they would have been brought back, or their knitting would have been curtailed after the first few rows. So I was keen to see how a non-acute trust was functioning, and I've been really interested in seeing that, been interested in the dynamics, and I've been amazed at how organised things are. So could I have the next slide, please? So I've worked in various aspects of healthcare, mentioned eating disorders. My PhD is in diabetes, and I'm now a trustee of the Independent Diabetes Trust, and I pricked up my ears when you mentioned diabetes previously. I also did an MBA. And I did my MBA in costs of quality in healthcare. And I was looking at it the other day, and I thought, yeah, my models then were still pertinent now. And I was invited to speak at various conferences in America and India. And I also was invited to Israel. And I've spoken at various meetings, but the one in Israel was the only time I had somebody with a machine gun patrolling the room. I presume it had been quite a difficult time in Israel with bombings on local buses, but it was quite unnerving to have somebody with a machine gun at the back of the room. Anyway, I survived and I'm back here now. I used to be editor of the Nutrition and Food Science, which is a professional journal, so I enjoyed that and I still review papers for it. And hospital food is a passion because unless we get people eating and keep them well nourished, they will obviously not thrive. They won't get out of hospital quickly. And I think that's one of the things that worries me. And I'm also secretary of the Hospital Caterers Association for the Oxford branch. So I'm always watching what's happening as regards catering. I understand your caterers here have got the Soil Association award, which is fairly unique for hospitals. I'm conscious of time and I'm conscious this is a very busy meeting, so I don't want to go on too much. The other thing I'm really interested in is environmental issues. So I was keen that we've got the green plan coming along soon. Also, I'm involved in farming. So I'm quite a busy soul. I used to keep sheep, used to love having sheep and shearing them, but they have long ago died because they were elderly. I never used to we didn't send many of them for meat. We just bred them and sold on their lambs. So I loved having sheep. So I used to run this organic farm, and I'm keen as well on the green plan that you have in the NHS. So I'm looking forward to hearing about that. I'm always trying to get involved and get people involved in various things. I've written umpteen books. I had one in the bestseller list, which was one I did on the GI diet. I don't know if you see that, with Anthony Worrell Thompson. I think if anybody's got, I feel awful just talking about myself. I'm not that sort of person usually. The one thing I do like doing particularly is public engagement. You've probably heard me say about trying to persuade the local historic society to lend us their premises, trains, buses, to engage with men and to link with the hospital to try and do some activities for men. Men's health, a real problem. And I was talking to the people at the Historic Transport Society, and they say, we're really keen on this and we want you to come along when we've organised days and all the rest of it. And they said, we're so keen because 2 of our members have just died. One with prostate cancer who didn't know how to check himself, and the other one was a rather unhealthy large gentleman who dropped dead in Asda, which is just over the way. So they were very, very keen on this. So I'm going to shut up and let you ask me any questions.
Wonderful, thank you, Mabel. Absolutely fascinating to hear about your journey and your role. Firstly, on behalf of NHFT, huge thank you for being a public governor and supporting us with all of your insights and your vast years of experience of supporting us, which is great. And also, you highlighted the importance of nutrition in itself a key indicator for improvement in healthcare, which if you don't get the right nutrition or hydration, your treatment and your health outcomes suffer from that, which is absolutely key. So let's see if there's any questions or quick comments for Mabel.
Thank you. About men's health, I think it's so neglected, and having a lot of gentlemen as patients, many of them neglect the fact that they're urinating quite a lot. So they've got signs and symptoms of diabetes and they just pass it on. I've known people with awful sores on their hands or other parts of their body and they ignore it, and that's turned out to be some form of cancer. So I think that men tend to neglect things. They like to have that stoical attitude. And I think I've mentioned before that I went to party in the park because we were asked to. I live in Rushden, where we have this party every year, and we were asked to talk to people about their perception of health. And I talked to some people. I took along lots of leaflets on diabetes because of being a trustee to the Independent Diabetes Trust. And some of the men who came up, they'd had no advice. They didn't realise the symptoms of diabetes. And I think with one gentleman, I could have still been there talking to him about his diet, because he really was enthralled about how to manage it, what could he eat, what was not best to eat. And I just feel there's just this big gap. And if I would imagine he will have problems in the future if he's not careful because of his very poor diet. So thank you.
No, thanks, Mabel. I mean, thank you for highlighting again the issue of men's health. And please let me offer you some reassurance that certainly NHFT and also in Leicestershire Partnership, we are very much alive to this issue, and we are trying to do as much as we possibly can to engage in a range of different ways with men to ensure that we can get men to talk about health matters, health issues, because we know from every research and study that's ever published is that if you get people in early and you get early diagnosis, then the health outcomes are far more easily treatable, and then the outcomes themselves are far better for those individuals concerned. So thank you very much for that. I'm not seeing any more questions or comments from anybody. So thank you. Huge thanks to Mabel for her presentation. And then we'll move on in that case, which is the Council of Governors report, which is paper D that was circulated. And this is with you, Richard.
Thanks very much, Faisal. Good afternoon, everybody. Yes, paper D in the pack is where we're headed next. So firstly, a very warm welcome to Wyn, who I can see on my screen. We had a great conversation as part of a governor induction a few weeks ago. Wyn joins us from the University of Northampton and takes over from Claire Clinker. So welcome, Wyn. I'm sure people will get to know you over the coming weeks and months. And thank you and goodbye to Chris Duff, who I think I saw on my screen. Yes, Chris is there. Chris has been with us for a number of years now and is a valued partner at Age UK. Chris is heading off into retirement not in the not too dim and distant future, and is handing over the baton to a colleague within his organisation, Chris Skelton, I believe. So, Chris, thank you so much for the work that you've done, both as a governor here at NHFT, but also as a valued partner at Age UK. And the very best of luck as you head into retirement. So, Chris, do you want to come in? Please do. You're on mute, Chris.
Just to say, I'm very sorry I can't stay for longer. I've enjoyed coming to these meetings and it's been very useful. My successor in Chief Executive at Age UK Northamptonshire is a Chris Stelling. So it will be him that takes over from me, sorry. And we've got a meeting set up with Richard to take him through that. So I hope you will give him a warm welcome when he comes, and thank you very much.
Thank you, Chris. So moving on in our report then, and we always like to feature some work that our governors are doing between meetings, and actually this time we're featuring some work that Mabel's been doing, and she talked about this actually a little bit in her governor's story a few moments ago, the service that she went on with David Williams and other colleagues to our new young people's facility at Berrywood Hospital. So you can read a little bit more about Mabel's story there. And indeed, I would encourage you to have a look on our website, where you'll find out a little bit more about the new facility at the SETS, which is a significant milestone for us as an organisation. So moving through, other things to highlight really this time, hopefully you will have all received and either read or plan to read the Trust magazine. So the issue 3 winter 25-26 is now out. If you haven't already accessed it, then we've included the link here in the slides, so you can click through and have a read. Equally, I think we heard from Marcella last time round at the Council of Governors, who shared a story. You've got the opportunity to view an interview that Marcella did on our YouTube page there, and again we've included a link for those that haven't yet had an opportunity to watch that. So at this time of year, in addition to us thinking about plans for next year, we're also thinking about the natural renewal process for the Council of Governors. So we have just launched our annual elections campaign, as you can see there on the slide. We've got several seats that are up for elections, so 3 in the Kettering and Corby public constituency, 2 in the Wellingborough and East Northants public constituency, 1 in Northampton public constituency, and 2 patient and carer seats. We've got a Become a Governor session, so if anybody's thinking about whether or not this role might be right for them, then they're very welcome to join us. I think it's in the early evening, to try and allow for people that may be working 9 to 5 to join us. We do tend to record these sessions actually, so if you can't attend live, then we may well be able to make a recording available to you. Of course, we are expecting existing governors that are able to do so to consider restanding as well. So really would just remind people that the elections are going on to promote the opportunity to people that might be interested in standing, and also to promote the opportunity to people that aren't yet signed up to be a member, even if they're not wanting to stand as a governor. Actually being a member gives you a say, gives you a vote, so it's a jolly good thing to do, and of course it's entirely free. So do have a look on the website. There's more information about membership and also specifically the governor elections on the pages that are linked on this particular slide. Now, we had the meeting of our Governor Standards Group, which colleagues will be aware is the group that both manage standards of behaviour amongst the Council of Governors, but also do several other governance tasks, one of which is to undertake a review of the Code of Conduct. To give me a bit of a rest from talking and for you listening to me, I'm going to hand over to Tracy at this stage, just to talk us through the outcomes of the discussion, so that we can move towards hopefully approving some revisions to the Code of Conduct. So Tracy, if I could hand to you at that point.
Yep, sorry, I was just trying to get it on my screen. I had it next to me. So we had a good meeting on the 15th of January, and it was just the sort of the biannual, every 2 years review of conduct.
Tracy, you've faded away. Is that just me, or is other people lost a bit of sound from Tracy? Yeah, I'm getting a few. No, you started off really well, and then you just faded back. I wasn't sure if you were a bit too far away from your microphone.
Oh, can you hear me?
Yeah, that's better. Thank you.
Yeah. Oh, I haven't moved. So that's really odd. This doesn't. I'll start again. Just bear with me. So as we put in the slide, the group did meet on the 15th of January just to do its sort of scheduled review of the Governor Code of Conduct. We identified 3 areas that, based on just a couple of things that had come up at the group, really, that we thought could probably just do with a bit of a refresh. So those 3 areas are listed on the slide, which is the attendance at the Council of Governors being the first area. We've just slightly tweaked paragraph 20 in the proposed Code of Conduct. Just because, if governors remember, back in October, we did discuss about or just re-clarified the expectations that the annual general meeting and any extraordinary meetings would count towards attendance. So we've just tweaked the wording to make that clear, sort of going forwards. And then the requirement to confirm attendance or send apologies has just been moved into a new paragraph, just so it's not lost in that one. The second area was on training and development. We recently had a discussion about the required training for governors. And we just wanted to clarify that any training that from outside the trust would not be accepted unless it was from another NHS organisation, and that is just because of the requirements of the trust. So it was just to set that expectation. So as we know, some of our partner governors, for example, have probably done similar training elsewhere, but they would have to do the NHS England volunteer training to make sure they're up to our requirements. And then there was just one final paragraph which was amended on visiting trust services. It was just to reflect the more refreshed process on how we invite governors to service visits, and it was only a minor amendment. And all those changes are in Appendix 1 that was attached. So hopefully everybody has read those. So it's really up for the council to agree or approve those 3 areas that have had some minor amendments.
Thank you, Tracy.
Thank you, Tracy. Richard?
I was going to suggest, Faiz, if we come back to that at the end when we wrap up, and we can then just go through and make sure whether people are happy with that, if that's okay. Lovely. Okay. So moving through then, I think I may well be coming back to Tracy on the next one. Yes, indeed. So Tracy ably facilitates the Membership Engagement and Representation Committee, which, as you can see here, met most recently on the 22nd of January. And again, Tracy, if you could just highlight the key points for us, that would be great.
Just bear with me. Yep. So the Membership Committee met on the 22nd of January. And we did a bit of a review of just the previous year and how things have gone. So just for a reminder, with the 3 priorities which are on the slides is increase the inclusion and engagement of children and young people, increase the inclusion and engagement of men of all ages, which we've just talked about. So that's obviously quite an important one, and increase the diversity of our membership to better reflect the diversity of the population. So essentially, we look back at the previous year, and the one thing we did agree or propose to the council is we carry those 3 priorities over into this year. We have made some positive progress. We've held various webinars, which hopefully people have been joining throughout the year. Governors have visited services. Governors have engaged with groups, and Mabel gave a good example of going to Party in the Park. But I know it was Heber, who's not with us today, but she went to a faith group as well, so she's been out engaging as well. And various governors have actually been filming some video content. And I was just typing in the box and forgot to press send, but as well as Marcella doing an interview, and I think Pete did a previous one or is doing one, both Summer and Richard and Ponza have both done a video on becoming a governor. So that, I think that's going to be used on social media shortly as part of the election campaign. So there is lots of opportunities there. So essentially what we agreed at the meeting is to carry over the 3 priorities. And what is proposed for this year is we try and do it almost by quarter. So we have like 1 quarter on engaging with men, 1 quarter on engaging with children and young people, and 1 on sort of the diversity element. And the sort of the 3 areas which we didn't quite get to last year, which hopefully we'll be able to achieve this year, is engaging with the men's group. And I think Mabel's idea has probably got us halfway there with that. So hopefully we can pick that one up. Engaging with the school or a youth group, I think, is one area we still need to pick up a little bit. And engaging with faith groups, which we've made a good start on. And actually, we've been linking with the spiritual wellbeing team on that. So they've been involved. So we have made a good start on that one. So we agreed that that's probably the best way to take forward the priorities. And then we just had a bit of a discussion really of how we do some of this, how we recruit members, and sort of in a more digital world now that we live in, using QR codes, which everyone is now familiar with thanks to COVID, ironically, the QR codes. And we thought about whether we can use a bit more sort of video content or podcast style interviews to better engage with the members. So that they are basically what the meeting discussed. So, and as we come back to at the end, but it's for the council to agree to continue the 3 priorities, and also to let us know if there's any of those 3 areas that you're particularly willing to get involved in. I know some of the people who were at the meeting did volunteer to help, so I've got their names, but if there's any of those 3 priority areas you want to get involved in, please do let us know, and we can link you all together and hopefully do some engagement work.
Super. Thank you very much, Tracy. So I'll perhaps hand back to you then, Faisal, for the decisions that we're requesting from the council. So firstly, to support the recommendations of the standards group in respect of the code of conduct, to approve the changes, and indeed if those changes are approved, then to note that all governors will be asked to re-sign the code of conduct. And then secondly, to approve the recommendations from the Membership Engagement Representation Committee, otherwise known as the MERC, as Tracy's described, in terms of rolling over the membership priorities, and as a supplementary aspect, letting us know that whether you're interested in participating in one or more of those areas. So Faisal, back over to you. Thank you.
Thanks, Richard. So thank you for the highlights from the report as well, both of you, and for pulling through the key points. So let's take the Councillors' Governance Code of Conduct, which you should have had an opportunity to review, which was attached as an appendix. With the changes proposed, are you happy to approve the Code of Conduct?
Yes.
Yeah, great. Thank you. I'm getting some nods. That's great. Thank you very much. And then with that now being approved and recorded, you all need to sign the Council Governors Code of Conduct. So we'll make sure that gets done as soon as possible, so we're all up to date. And then it's the Membership and Engagement Representation Committee, the changes proposed there. Happy to approve those? Yeah, I'm getting a few nods. I can only see one screen at a time, and we're across 3 screens. So yeah, great. Thank you very much. So that's done. That, I believe, brings us to the end of the report of the Council of Governors report. Richard, anything else to say in closing? Or
no,
Tracy?
only to point out the meeting dates that we've listed at the end of the report there, just for Governor awareness. But other than that, no, thank you very much.
Great, thank you, Richard. Yes, on the last slide on page 8 in the pack, you can see the dates there. Thank you very much. And then it's on to the updates from Chair and Chief Exec. Well, we've had Angela and Managing Director from Dave's report. In terms of key updates from me, I think going forward, I think what we will do is circulate the Chair's report as well. So I know we do it in the public board circulation. Tracy and Joe, if we could do that, and also the Managing Director's report, if we could do that, so they have it as one part of the pack, which will be great. Just a couple of really quick highlights. One is that I believe, if I'm right in my estimation, this is going to be your last meet. Robin Burgess, who's our non-executive director, he finishes at the end of March. So I'd like to say huge thank you whilst we've got him at the governor's meeting. A huge thanks to Robin for all his service and his engagement with everything and support for NHFT as a non-executive director. And given that Robin's will be leaving us at the end of March, one of the things that I'll be doing, working with Julie as the deputy chair for NHFT, is just looking through and just tweaking and making sure that we have clear representation across the committees of the board to make sure that we've got the right level of balance and expertise and experience in those committees. So we're nearly there with that, and concluded with some of the mid-year appraisals of all the non-executive directors. The other thing that just to share with governors is that since becoming interim group chair on the 1st of November, one of the key things I've been keen to do is make sure that I'm building relationships with all system partners across Northamptonshire, but also Leicester, Leicestershire and Rutland. But beyond that in the region and nationally with NHS England and other partners beyond NHS England. So to ensure that we're all linked in, and I've tried to use my time very effectively to get to some key chairs and chief executive events and roundtable and consultation events. It isn't just for me to go away to these things or virtually. It's very much about making sure that we're at the table where it matters, making sure that the voice of NHFT and NHF Northamptonshire's communities are represented at those key forums, and making sure that anything that comes out of those events is then brought back to NHFT. So I hope that's okay. I'll just pause very briefly if there's any questions or any points of clarification or any comments. No? Okay, great, thank you. As I say, we'll make sure that we'll have in future the actual report in the written ones also included in your packs. Tracy, if we could make sure that we just send the current ones that were circulated to the public board post-meeting, along with anything else that needs to go out, if we could make sure that goes out. Tracy?
Yeah, I was just going to say, I believe the links are included in the cover email, but we can recirculate them if people haven't seen those links. But okay. I believe the links to at least the board report that you've mentioned were in the joining email. So just to make sure everybody's got them, I'll include them in the governor mailing.
Thanks, Tracy. I must have missed the actual links. I was too busy looking at the papers, so dive straight into the paper pack rather than look at the links. So no, thank you for that. In which case we'll move on to item 9, which is our non-executive director, Judith and Joe, who will be presenting for risk and assurance. And I believe our topic, which was raised in the workshop earlier, is the green plan. Over to you, Faisal.
Thank you, Faisal. So I'll start off. For those who don't know me, my name's Joanne Lancaster. I'm one of the non-exec directors. I'll do the first few slides, setting a bit of the context, and then pass over to Judith, who will pick up more of the nuances for the NHFT green plan. So if we could have the first slide, please, Tracy, thank you. So by way of background, just to set the scene, NHS England, NHSE, sets strategic direction about what we should as a health system be trying to achieve. And just reflecting broader societal changes, they've set a very bold ambition, which is for the NHS to be the world's first net zero health system. This isn't a new ambition, it dates from 2022, but they issued some fresh guidance February 25, I think it was, which is the reference point really for our current plan. So our current plan is, again, not our first plan, it's our second green plan. And it includes a retrospective look back at what we managed to achieve in our first plan, which was the 2022 to 25 arrangements. But what it does then is then do the forward-looking bits, which sets our ambitions over the next 3 years. So if we could have the next slide, please, Tracy, thank you. So net zero is a phrase that's bandied around quite a lot, and different people interpret it differently. But from our perspective, the things that are really important are the things that we have direct control over, and those things, the emissions that we generate as a trust directly. The goal that's been set is that we are net zero by 2040. With a sort of midway staging point where we should have 80% net zero in our 28 to 32 plan. Then there's a second range of things, of other priorities, which are those things that we can influence. So this is things like our supply chain, our partners and things like that. And the idea is that we create what they're being referred to as carbon footprint plus agendas. And again, we'll try and influence as far as we can those people who are closest to us to meet that net zero ambition. But this is a slightly longer time scale. So this is by 2045. Now, importantly, the baseline against which we're measuring this is dating from 1990. So we've already started to do a lot of work, and I won't steal any of Judith's thunder, because she's going to talk you through some of the details of what's happened in the past and what we're aiming to do over coming years. But critically, if we take those two strands, those things that we can have direct control over and the things that we can influence, those are the things that we're working on. So if you could move to the next slide, please. Now, again, another phrase that's bandied around a lot is the notion of sustainability, and we've been very clear and consistent in what we mean by sustainability. And this slide just puts in very simple layman's terms what we mean by that. So it's all about providing the highest standards of healthcare, whilst having regard to and balancing against the impacts that generates. So as you can see there, the three impacts that form part of our sustainable development ambitions. First one is around environmental impact. This is one that people closely associate with sustainability. It's about reducing the impact of what we do. And some of that is very obvious about removing single-use plastics, how we fuel our vehicles, things like that. But as Judith will explain, there's a lot more subtlety to how we're trying to do that. The second one is not often promoted as part of sustainable development, but we see it as absolutely central to what we're doing, and our plans have built this in. And again, we're working across our committee structures to make sure that we can properly connect with this, and this is the social impact of what we do. And there's you can see from our Thrive strategy, which David Williams talks a lot about, but it absolutely cuts through everything we do, which is about reducing health and social inequalities. And that, from our trust perspective, is absolutely fundamental to the agenda around sustainability. And this could be, in terms of how people access our services, how we provide services to some of our rural communities, different ethnic groups, all sorts of things like that. And then the third leg of our sustainable stool is that of financial impact. And obviously, everybody knows about the pressures that are being put through public services at the moment, but it's absolutely essential that the Trust's medium to long-term financial plans are stable, and we can offer a degree of confidence about financial resilience, not just to NHS England, although they're very interested in that, but more so to the communities that we serve, because it's absolutely essential that our communities have confidence in the Foundation's ability to provide that enduring relationship with our patients. That's it for me. I think next slide, I think I'm handing over to Judith now. So over to you, Judith.
Thanks, Jo. So the Green Plan itself is quite a detailed document which addresses a number of different aspects and work streams of our organisation, because as you all appreciate, NHFT and like any NHS trust is hugely complex, and to achieve this overarching aim, the net zero, to be sustainable, all the concepts that Jo has been explaining, will take multiple efforts. So the plan, and we have published our Green Plan, looks at a number of different areas on how we work, how on a daily basis, on workforce, things like recycling, that's a really simple, on travel, so our car fleet, which is moving to an electric car fleet, our estates, which we'll talk about a little bit later, but the estates and where we offer our services need to also be green, and therefore the Green Plan, the estates plan, and also our finances all need to be linked together. So those, I won't go through with all the different bullet points because you can read, and I'm not going to insult you by reading it out to you. But the idea of really here, the assurance that I'm certainly seeking to give, is that the plan is multifaceted, that it looks at us as a trust and the different work streams that need to work together in order to deliver the plan. Can I have the next slide, please? So what we've done here is bring two examples. And these are just case studies. They're just a snapshot example of the work that is being done. Neither of them are comprehensive because we don't really have the time. But we first case study is starting with food and nutrition. So Mabel, I really hope that you're going to enjoy this bit. And we started with this because when we talk about on an individual basis, certainly when I talk about sustainability and the green plan, I look inside to what it is that I can do myself. And apart from the car that I drive, it's what I do around the home, how we eat, how I produce what we eat, and the waste around that. So the first thing that's really interesting, and I wasn't aware of this until I came across it through NHFT, is that there has been a research done in relation to reducing food waste and increasing food intake by patients, and especially elderly patients or people who are suffering with dementia or some other ailments, for instance, mental health ailments, actually they seem to have better appetite. Certainly the increase of food intake is quite substantial if the plate that the food is presented on has quite a strong contrast with the colour of the food that is being eaten. So blue, being there are very few blue foods out there, blue is a really good contrast. So there's been multiple trials in hospitals. Food intake increases by 10% and food waste decreases by 26%. So it's really quite phenomenal numbers. So NHFT has started that. There has been quite a substantial reduce of food waste. But in addition to that, for instance, vegetable peelings are now recycled into other types of food, like onion bhajis. Some leftover surplus fruit and bread, they're resurplused into bread and butter pudding. All the things that we do at home is now done at a more industrial scale, which has not really been done before. The other way of improving sustainability is really to look at what we're offering. So why is the food wasted? The food is wasted is because it's not what people want to eat, and potentially it's not as healthy as it could have been. So there's been a real revamp of the menu that's been offered. We're following the 50-50 model, so there's less processed meat in there, less red meat in there, and this trial that is being carried out at Berrywood has achieved zero plate waste. So that is a really fantastic outcome. And the final aspect of the food and nutrition is really, so we talked about what wastage there is, what we're actually offering, and this is looking at the workforce itself. And it's the uniforms. Everybody within a food kitchen and food environment needs to wear a proper white uniform, and that uniform clearly is a cost to the organisation. We have now found a source of uniforms which are made out of 65% recycled plastic bottles. Now, I've seen the pencils that are made out of recycled plastic bottles, and I have seen wool, I'm a knitter, that is made out of recycled wool. But this I've not come across before. So this is sort of really quite exciting. So these are the types of initiatives that are being carried through under the food and nutrition element that I thought would be interesting. Can I have the next slide, please, Tracy? The second case study is around green spaces. So especially because we are a mental health trust, green spaces and what's in our green spaces is super important, not just for our service users and patients, but also for staff. So NHS has now secured a tree planting project, which is due to start in 3 years to, I think, 2 years now, where we will be planting native fruit trees. So this isn't fruit trees that have been imported from elsewhere, but these are native fruit trees. So hopefully we might even be able to save a couple of rare apple varieties. I don't know yet. And the fruits and the nuts from these trees will be used in our kitchens. And not only will there be a really nice environment in the spring, summer and autumn, but also something that we can benefit from by way of increased nutrition and improved nutrition. So that is the green spaces. And as you can see, these two examples are already showing how our estates and what we do with our workforce and our green plan are all interlinked. And that is how we're wishing to produce the benefits out of this strategy. Can I have the last slide, please? So what we've got here is the very broad bullet points of the different ways that the Performance Committee and board receive assurance around the Green Plan. But I just wanted to sort of pad that out a little bit before we go into questions. The Green Plan is not a piece of paper that is only available and only lived, if you like, from the board down. I'm in a really fortunate position that I regularly attend something known as a Dragon's Den. It's part of our innovation within the trust, where staff are encouraged to bring projects for seed capital to put into effect. And through the Dragon's Den process, in fact, I've been part of the dragons who've been who've agreed to give funding, seed capital, for a number of projects which in effect have sustainability and green plans at heart. So staff are very involved in these. So the big picture things like light bulbs, we're already there, we've done that. Car fleet I've already touched on. Our buildings, as a trust, we're actually quite fortunate that we do not have really quite ancient Victorian, leaky, single glazed windowed buildings. Quite a lot of our estates are modern, so we are quite advanced in comparison to some other trusts. We do recycling. We're working with our procurement teams to ensure that what we procure, the contracts we procure, have a focus on local, i.e. less energy wasted transporting things to us from elsewhere, but also that we have a more joined up procurement process, which will also have a positive impact on the Green Plan. Please rest assured, Mabel especially, the Green Plan is something that is dear to my heart, and it is something that gets regularly discussed at Performance Committee. But I'm really happy to bring it to a close, very conscious of time, and answer any questions that you may have.
Thank you, Judith, and also to you, Joe. I don't think anybody's been left under any illusion that the Green Plan and the sustainability part of it is nothing other than active program and active range of activities behind it. So thank you very much for that very informative presentation. Let's go straight to questions, comments. Adam. Adam, you're on mute. Yeah. Go for it, Adam.
Yeah, sorry, I think I appear to have been booted out very briefly, so apologies. I'm not sure what happened there. So thank you both for the presentation. I think some of the answers you may have alluded to in what you just said, but a couple of things I wanted to pick up. Firstly, was I think the secondary benefits in terms of improved nutrition, improved environment, local environment, and particularly in the context of people's well-being, I think is really, really important. And also, I think, and it was in the sort of the two different levels, I think there's a real challenge around procurement where there are some things like pharmaceuticals, for example, which are quite difficult to eliminate, for example, if they're products that the trust purchases from abroad, it can be quite difficult to source local alternatives. I just wondered what the sorry, before I go on to the question, and clearly by improving efficiency and reducing waste, there are some benefits financially as well. I just wondered what the financial impact of these initiatives are in the short term. Is it a case of having to sort of spend a bit of extra money in the short term to achieve these outcomes in the longer term?
Shall I? Oh,
yeah, go ahead, Joe. No.
Well, so in terms of the procurement aspect, Adam, like all public agencies, the NHS has a fiduciary duty, so that has to be responsible to ensuring that every pound is spent is the best way that you can possibly spend that pound. And quite a lot of the changes that have happened into the procurement regs are allowing a lot more flexibility in how things are procured. And given that this is a national push, some of the barriers previously to procurement, I think, have been removed. So it's much easier now to add in the requirement that it has to be locally sourced, or to break contracts into smaller bundles so that more local providers can meet some of the bids, because previously those massive contracts weren't often open to local suppliers. So some of that has changed. I think medicines are different. I think medicines, given the licensing regime and the impact of NICE approval, I think that is quite tricky still. But with regards to things like the secondary benefits, I mean, some of this stuff is it's so obvious, just doing the right thing. If you do it right, Judith's example about food waste, nobody wants to buy and then prepare food that isn't eaten. And if we get it right and we ensure that we're measuring the right thing rather than generating perverse outcomes, this contributes not only to environmental improvements, but it also improves patient recovery times. It also ensures that we end up with more sustainable financial footings because we're not wasting money. So I think it is a bit of a virtuous circle. And if we get this right and understand how we're measuring things and what the results are telling us, we can then have much, much better informed conversations about what the next version of the Green Plan can look like. But Judith, you might have other stuff you want to add.
Yeah, thanks, Joe. Really appreciate it. Adam, you asked about investing. That really needs to be next to nothing or minimal investment in order to make these savings. Because if you think about it, we probably spent some money on buying some blue plates rather than having to invest massive amount of money. Because what you're doing here is you're subtly altering behaviour. You're not spending loads of money to do something totally differently. So it's just like we would be doing it at home as well. So the Performance Committee now have a document which links the benefits of the Green Plan and the estates and finances together, so you can see how they all interlink. So you're absolutely right. We are driving out the benefits financially as well. A little bit early to start saying how much we're saving, but that's something that will be coming up through the committee. And as Richard, you also asked, this isn't an HFT plan. LPT also has its plan, but at group level is where sustainability is overseen. So it's a bit of both.
Yeah, thank you, Joe, and you for that. And Richard, just on that last point, your question, you'd expect us to maximise and join up where it was right to do so with LPT, which is exactly what we do, and we're very mindful of looking for opportunities where we can do it much more collaboratively. Laura, question from you or comment?
Hi, I just wanted to comment. I was really pleased to hear how we're using colour, like the coloured plates, to make the food look more appetizing, and reusing the food, leftover bread, made bread and butter pudding. There's so much food waste and so much processed food, which I really do personally believe that's got a lot to do with a lot of the ailments we have today. So it's just really pleasing to hear that all around, even in the public health, we're moving on food initiatives and healthy food, healthy eating. So it's really, really pleasing to hear. Thank you.
Yeah, thank you, Laura. Any other comments or questions before we move on?
I put my hand up.
Just before we move on from this item, go on, let me bring in Mabel. Mabel, you just put your hand in very quickly there.
Thank you. That is so good. But I think it's a shame you're not communicating it more to the general public, what you're doing. And also you have some lovely recipes from your caterers. Those would be lovely to give to some of the relatives who visit the patients, because the more we can encourage people, the better it is.
Yeah, thank you. We'll take that away, Mabel, and see how we can help implement that and utilise that approach of using repurposing food and with recipes, as was shared in the presentation from Judith and Joe. And the other thing I just wanted to, in closing, to point that in the Joe's part of the presentation, which was about the social impact and the value of a green plan isn't just about sustainability and all the things that we think about the environment, etc., but also the role that we play as organisations, where we're located, what kind of transportation we use, the buildings and building materials that we use, and the impact on communities, and how our role in helping to address health inequalities is all wrapped in there. So I think that was a really useful bit of that presentation as well. So a huge thank you to Joe and Judith for the presentation. So that brings us to the end of the formal part of our agenda. I've not been advised of any other business today, so I'm not expecting anything. Is there anything urgent anybody wishes to raise before I close the meeting? No? Okay, thank you. I'd just like to take the opportunity to remind you that our next meeting of the Governors, Council of Governors in public is on the 16th of April 2026 at 10:30 a.m. And just as a reminder, the Council of Governors meeting in private has been stood down today because there was no items that we needed to discuss in private. So please don't try to join a meeting later because we're not going to be there. And with that, been an excellent meeting. Thank you everybody for your contributions, and those of you who were involved in the workshop earlier, thank you very much for that as well. And therefore, all that remains for me to say is thank you, have a good evening, and goodbye for now.
Thank you. Bye-bye.
Thank you. Bye,
Bye.
everybody.
Bye.
Bye-bye. Bye.
Thanks.